Hello, joining us on Ominira TV is Professor Thaddeus Iheanacho from Yale University. He's a professor of psychiatry, and together we'll be looking at mental health in Africa. Welcome to Ominira TV, Professor Thaddeus.
Thank you very much.
Okay, so we have more than 500 million people, facing mental health challenges worldwide, and more than 70% of them do not have access to proper care. Putting this in the African context, I mean, it would be worse. The statistics don't be so good too in Africa, considering the stigma attached to mental health. What is the Happiness Project about, and how is it going to address all of these challenges?
So first of all, yeah, the statistics you said is about the worldwide impact of mental health and the limited access to mental health treatment. But in Africa, it's even worse because we have more stigma around mental health, like you said, but also we don't have a lot of resources, human resources, specialists who can treat mental health in Africa, unlike in other developed part of the world where they have a lot more resources. So because of that, the impact of mental health on people in Africa is worse than in other parts of the world. I think the complicating issue in Africa as well is the issue of poverty and limited access to other elements of life that makes mental health even more worrisome. So I do think in Africa we face a triple challenge of limited access, more morbidity, and poverty. So the Happiness Project is trying to address the key element, which is the availability of those who are able to provide treatment for mental health disorders. We want to train those who are already in healthcare to do mental health treatment. And that is something the WHO has shown to be an effective way to increase access to mental health treatment. So you come in, you train people who are already seeing people for other medical problems, and in addition to that, they can provide screening, assessment, and intervention for mental health disorders. And then when they need to consult a specialist, they can consult a specialist, which is not all the time. So in the Happiness Project, we are hoping to connect these people that we have trained to available specialists both in Nigeria and abroad. Yes.
Okay, that's interesting. I also know that it's a collaboration or a partnership between the Yale University and also certain organizations and institutions here in Nigeria, at least for now. How is that working out?
It has worked out beautifully. So Yale has the capacity for implementation, evaluation, training, clinical support, and in places like Imo State and other parts of the country and even Africa, we have primary care teams who are doing immunization, tuberculosis, HIV treatment. So what we're trying to do with the partnership with the Primary Care Development Agency in Imo State and other parts of Africa, actually, we are bringing together the knowledge from Yale around training, evaluation, and support to these clinicians who are already doing clinical care in the community. And then we've partnered with 2 or 3 NGOs who have supported us financially and provided some financial backing for us to do this project, at least at this early stage. We're hoping that as we show results, we're able to scale this intervention, the Happiness Project, to other parts of Nigeria, to other states, and also other parts of Africa. Because this problem we have in Nigeria is not just in Nigeria. The same statistics, the same challenges that Nigeria faces is being faced in Rwanda, is being faced in Ethiopia, is being faced in Uganda. So we hope that as we progress and we'll show that this is doable, we can do this in other African countries.
I like that you emphasized on, scaling to other parts of African country. This is the start of a new decade, and what are your projections? What are you looking to have achieved, say, in the next 5 years? How many countries are you looking at scaling to, in the next 2-3 years? Can you just give us timelines that you have in mind for this project, and what you hope to achieve in Africa at the end of the day?
So what with funding, we can do a lot. So if we have funding, say we have a magic wand, and I'm able to raise all the money that we need, training doesn't take a lot of time. We can train as many people as possible if we have funding, and we can provide support to as many people as possible. So within a 10-year period, I see us spreading to a few other African countries, saturate in Nigeria, then transition to a few other African countries within the next 10 years. I think that's completely doable.
And how do you hope to measure impact? I think I asked that earlier, but just to emphasize, what are your key indicators to measure how far you have been able, how much you have been able to achieve?
So a couple of ways to measure impact. One is how many people have we trained? Among those people that we train, how many of them are practicing the training in their clinical setting? And in terms of clinical outcomes, how many people have they treated? How many people have they screened for mental health disorders? How many people have they provided treatment to? How many people have they connected to specialist care? And how often do they provide treatment? So these are all measurable. And then we can go down and say, of the people that they've treated, how many of them are getting better? So if you come in with depression, you see this person with trend, you get some treatment, have you gotten better? How many of those people have gotten better? So these are all the things we're able to measure. Yes.
And finally, what would you like to say to everybody out there who still stigmatize those who face mental health issues, especially that, here in Nigeria, where they just refer you to a spiritual mode of treatment once you say you are not okay or something? What would you like to say to everybody out there listening now about mental health in Africa?
So I want to be very clear. Mental health disorders are disorders like any other disorder, like diabetes, high blood pressure, meaning there are combination of medication and lifestyle changes that can help improve your treatment. So if you had diabetes, you would get medication for diabetes, but also manage your lifestyle, do more exercise, don't eat sugar. If you had mental health disorder, you would get your medication, but also get support like therapy and counseling. So this combination has been shown all over the world to help people who have mental disorders manage their life and live their full lives, just like people who have diabetes and high blood pressure, take their medication, manage their lifestyles, and live their full life. So if you have mental health disorder, there is treatment that is effective. Second thing I think is important is there is stigma around mental health. So I really would want to spread the word that mental health disorders are not death sentences. It's not caused from the gods or from evil spirits. However, churches and religious institutions and schools can provide support for people struggling with mental health issues. They can provide counseling, they can provide social support, but also people need to get actual medication for these disorders and then see a therapist when available. And that is what we're doing in Happiness Project. We are training people to be able to identify these disorders, provide the medications, provide counseling, in addition to the church support and the school support and the community support that are out there. So all of this can go together. It's not this or the other. I would condemn things like
we need a multifaceted
approach
to ending mental
Mental
health stigma in Nigeria and in Africa as a whole.
absolutely.
Thank you so much, Professor Thaddeus Iheanacho, for joining us on Ominira TV to talk about mental health in Africa.
My
It was
pleasure.
a pleasure speaking with you.
My pleasure. Thank you very much.